Dear doctors and students, welcome once again to another session of mine on pathology, and in today's session we are going to discuss something that's really very important not only to all pathologists but to all medical students and doctors, because this is a topic called lymphoma. And lymphoma, trust me, is always so confusing that you actually open the textbook, you read the first page, you realize that when you go to the next page you've actually forgotten what you read in your previous page. So in today's session, let's actually try to break lymphoma into smaller bits and let's try to understand in a simple way on how to understand the basic concepts in lymphoma, types of lymphoma, prognostic indicators, clinical features, microscopy, and most important of all, immunohistochemistry. Okay, so we start with the first slide, lymphoma's definition, which I have already stated in this slide here, which is malignancy of lymphocytes. Okay, as you all know, lymphocytes are part of the white blood cells in the body. Okay, we have many white blood cells, lymphocytes, neutrophils, eosinophils, basophils, and so on. And lymphocytes are the cells that are responsible for what kind of inflammation? Yes, chronic inflammation. So lymphocytes are the cells responsible in chronic inflammation. When lymphocytes increase, what is the condition called? When WBCs increase, it is called leukocytosis. For those of you who answered leukocytosis, very good. Okay, so when WBCs increase to a certain extent, it is leukocytosis. When they increase to massive proportions, it could be a malignant proliferation. So we are actually going to talk about a malignant proliferation of lymphocytes today. A typical case of lymphoma presents like this. Have a look at this slide for a few seconds before I continue. You can actually see a structure here which is large, irregular shaped, which has many nodules, and actually if you see, this is about anywhere between 12-13 centimeters in size. Now, is that the normal size of a lymph node? This is a retroperitoneal node that was taken from a 21-year-old male. Is this a normal size of a node? Definitely not, because a normal lymph node would be much smaller. And this is a large irregular growth and it has multiple nodules, and this itself shows that this is a sign of malignancy. So point number one, my dear students, is that when you cut a lymph node with a lymphoma, it cuts with a firm, rubbery sensation. Lymphomas occur both in the lymph node and outside the lymph node. So for this, we differentiate it as nodal lymphomas and extranodal lymphomas. And you classify lymphomas as Hodgkin's and non-Hodgkin's. Simple. Lymphomas are either Hodgkin's when they have a particular type of cell called the Reed-Sternberg cell. Now, don't worry about it right now. I'm going to talk about Reed-Sternberg cells in a few slides from now. And the second part of lymphoma is non-Hodgkin's. Well, how do I differentiate between Hodgkin's and non-Hodgkin's lymphomas? Easy. If it has a Reed-Sternberg cell, it is a Hodgkin's lymphoma. If it doesn't have a Reed-Sternberg cell, it is non-Hodgkin's lymphoma. Well, pathology can get as easy as that. In fact, so can medicine. Okay. Now, your next question to me would be, now, I can always diagnose as lymphomas. Why do I have to classify them as Hodgkin and non-Hodgkin's lymphoma? And as we go down by a few slides, you will realize that there are other more types of lymphomas like B-cell lymphomas and T-cell lymphomas. Why should I know all that? You see, you classify a lymphoma to provide a diagnostic criteria. Based on the diagnosis, you are actually going to decide what is the treatment for the lymphoma. And at the same time, classification is going to help you in a prognosis. For example, you may realize that a peripheral T-cell lymphoma is much more poorer in prognosis when compared to a B-cell follicular lymphoma. And this is also going to help you to compare treatment trials. Okay, in terms of clinical trials, if you are in pharmacology, if you are in the industry and you want to do some chemotherapy, this is really going to help you a comparison of treatment trials. And most important of all, classification should be reproducible. Whichever country you go to, tomorrow if you actually go to the US to do your masters, or you go to the UK to do your masters, you cannot actually say that, okay, this is a case of a lymphoma. It should be a common classification which is available in all countries world over. That is the reason we classify lymphomas into this category. And that is why you have to know it as medical students. Okay, the most important clinical presentation of lymphoma is persistent lymphadenopathy. Okay, you may have lymphadenopathy in many conditions. It could be in any chronic inflammation, the lymph nodes enlarged. If you have an abscess or any infection in the tooth, your lymph nodes in the cervical area enlarged. If you have a person with infection in the scalp, the occipital nodes enlarge. An infection in the groin, the inguinal nodes enlarge. But if it is persistent lymphadenopathy and it has other effects such as obstruction of the superior vena cava with involvement in the liver and spleen, hepatosplenomegaly, or any other extranodal swelling in the case of extranodal lymphomas, these are the clinical presentation that you will get in a lymphoma. And if the patient has fever, anemia and weight loss, these are called as B symptoms. And when you have patients with B symptoms, remember, it has a poorer prognosis. How do you diagnose a case of a lymphoma? Now, as much as diagnosing many other surgical conditions or medical diseases are easy, you can actually diagnose it with a clinician or with a surgeon. Diagnosis of a lymphoma is a bit more complicated. You will actually have to do a microscopic diagnosis by the histopathologist, who will do the grading also. We are going to see what is a grading later in subsequent slides. And then a staging has to be done by a radiologist and the clinician. And then we do a bone marrow trephine biopsy. There are different types of bone marrow biopsies. I'm sure you know that by now, but just to let you know that the main two types of bone marrow biopsies are one, aspiration biopsy, and the second one is a trephine biopsy. Can one of you tell me what is the difference between aspiration and trephine biopsy? Think about it or write it on a paper. I give you 30 seconds and then we discuss. If you don't have a paper, take an ink pad or your notepad in your smartphone and just write down the difference between a trephine biopsy and an aspiration biopsy.